Hi everyone, I'm Dr. Somlina and welcome back to my YouTube channel. When I had secured a rank of 702 in my NEET PG that was held in 2021 and chose MD Radiology as my subject at a government medical college in Kolkata, people told me, wow, you have made it in life. Such a chill branch, no emergencies, big money, just sit and scroll and sit and scroll or keep rubbing the transducer over the belly of the patient. But after completing my 3 years of residency and my senior residency going on, do I still think that radiology is a bed of roses? See, every rose has thorns, such a cliche, and radiology as a specialty has really sharp ones. Let me show you the side of radiology which no one has probably told you. As they say, radiology is the crown jewel of all NEET PG branches, which I do not agree because I think that what is the crown jewel depends on what you want in life. But whatever. This is the common notion that people have. It is seen as the air-conditioned lifestyle branch with minimal clinical load, no night on-calls almost, and working with very glamorous, up-to-date technologies. But what most students don't know is what radiology is quietly taking away from us. Not just emotionally, but physically, mentally, or sometimes even existentially. I'm not here to discourage you. I'm just here to tell you what no one had told me before I entered this branch. Hear me out. Point number 1 is the posture trap. When I entered this department 3 years back as a first year resident, what I saw is everyone is almost always sitting. Now you might think, what's bad in sitting? It must be very relaxing to continuously sit and work, especially when you're not posted in any emergency radiology department or during the interventions. But no, studies have shown that prolonged period in front of a screen leads to this classic forward head posture with rounded shoulders, thoracic kyphosis, basically early burnout of your cervical and thoracic vertebra and the associated muscles. So what happens here is an upper crossed syndrome where the muscles that are in the anterior part of your neck and your chest, like the sternocleidomastoid, the levator scapulae, the pectoralis, they become tight and short, and the muscles of your posterior neck and upper back, they become relaxed, they become, stretched out and weakened. So that's why we have this posture. The end result is chronic pain and a complete mess of your posture, which keeps worsening with time. Point number 2 is the toll that it takes on our wrists. So basically holding an ultrasound probe at different awkward angles as possible. Not only that, while we are working at the pack screen, continuous scrolling of the mouse and clicking and typing on the keyboards, all this repetitive wrist motion leads to this cumulative strain which we often ignore in the initial stages. So obviously radiologists are not exempted from median nerve compression syndrome, which is the most common nerve impingement that is seen in radiologists. In fact, amongst all the specialties, we are one of the prime candidates to get this disease, leading to tingling, numbness of the sensory area of that nerve. Point number 3 is the strain it puts in our eyes. So basically, our most precious diagnostic tools are our eyes, and our eyes take the silent beating of continuous exposure to the light from the screens. Endless hours on the PACS screen, on the ultrasound machine screen, dimly lit rooms, poor ergonomics, not using spectacles. You start developing what we call asthenopia. Strained eyes, dried eyes, blurred vision, and that gritty feeling in our eyes. It's not just annoying, it's chronic. And trust me, when your job is to find out tiny hemorrhages, tiny calcifications, visual fatigue is a real occupational hazard. Let's move on to point number 4. It is the emotional baggage that comes with this subject. Why I'm saying so? When we started studying MBBS, and those of us truly wanted to be a doctor, we wanted to be that doctor who would see patients in our chambers or in our clinics or in our OPDs, keep following them up, ask them for investigations, prescribe medicines. But are we officially allowed to do that? No. Not only that, in this branch, you're rarely seen, rarely known. You may diagnose, but you don't treat. You report, but most often than not, you do not follow up. Most patients don't even know your name. Name to choro, they do not even recognize that you are a doctor. How will they recognize? Do you have stethoscope hanging around your shoulders. No, you have headphones dangling on your shoulders. How would they know whether you are a doctor or not? So that is a different kind of wound that we are all bearing. If you are female, you are a sister, you're didi and whatnot, but not doctor or madam. And yes, while I respect deeply all the healthcare roles, sometimes not being called what you are, it does sting, because I have given almost 10 years to this profession. And this not calling me doctor sometimes makes me feel as if I am invisible. So will you be okay with that form of unfulfillment? Because it's not about your ego, it's about your identity. Point number 5. Being a radiologist is a high stakes responsibility. See, there is one more myth that radiologists are completely safe from medical legal troubles. No, our reports are often the first domino in a chain of diagnosis. Miss one subtle finding and it could lead to misdiagnosis or delayed treatment. Not only that, even if you had diagnosed something well and there was some kind of delay from the patient in getting diagnosed, and yes, you will be blamed. Even if the image quality was poor, the ultrasound machine was suboptimal, even if the findings were borderline, who is responsible? Radiologist is responsible because they did not diagnose the case. See, often it is not possible to diagnose something with 100% guarantee. We only have circumstantial evidence to say this might be the diagnosis. But since we are not seeing the patient clinically all the time, we cannot give an accurate diagnosis just by seeing those borderline findings. It's not possible nahi hota hai yaar, but fir bhi people expect us to do that, and if we are not doing that and there is some delay or some problems in patient treatment, it's radiologists who more often get the blame. So radiology comes with a lot of responsibility and a near zero margin for error. Are you ready for that? And finally, point number 6, a reality check that setting up your own private diagnostic practice, it's not easy. While if you're doing an MD in a clinical subject or MS in a clinical subject, you can see a patient with just 2 sets of chairs and a table and a pen and a pad. But here, even if you're trying to buy a second-hand ultrasound machine, it costs a lot. So setting up your own private center, it is something only which you can only do if you already have a center from your previous generations or after certain years of earning money. Not only the cost of the machines are high, they even require a lot of money for their maintenance, for all the licenses, for the space that you need to set up those machines. So if you do not have a financial backing, then setting up your own private center early in your career is highly unlikely. So what is my final message? Radiology, as everyone thinks, isn't just about sitting in a cold room sipping hot coffee. It's about seeing the unseen. It is also about bearing these silent burdens which I spoke to you, these physical strains which I talked about, bearing the emotional invisibility despite working hard, and this constant fear of missing something. So, given a choice, if I were giving my NEET PG today and I had got the same rank, would I still choose radiology? I would, definitely. But I would also wish someone had told me all these things before I chose it. So if you are choosing radiology, choose it with open eyes, strong shoulders, and a resilient heart, because it is not soft, it is not easy, but if it's right for you, it will all be worth it at the end. Thank you.